Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today, in our weight loss series, we're going to talk about polycystic ovary syndrome. There's lots of background information on that. I'll briefly touch into that and maybe give you a little tips for weight loss. Again, this is not an exhaustive video, just a short one to give you some ideas that might help you. So, polycystic ovary syndrome is a collection of findings, and you don't have to have all of them to have polycystic ovary syndrome, but it is a tendency to have a weight problem, a tendency to have hair growth between your belly button and your pubic hair and on your face, dark hairs, a tendency for acne, a tendency for diabetes or diabetes in the family, and a tendency to have irregular periods, a tendency to have a bunch of little cysts in your ovaries, that's the polycystic ovaries, on ultrasound, but you don't even have to have an ultrasound to have that diagnosis of the syndrome. And then a tendency to not ovulate too often. It's called oligoovulation, which means a little higher chance that you'll have difficulties getting pregnant. So putting all that together, most, not all women who have polycystic ovary syndrome have a problem with their weight and want to make an effort to get their weight down, because doing that will help regulate your periods, increase your chances of having a pregnancy if desired, and reduce some of the extra risks that you have, which is future risks of diabetes, of heart disease, so of high blood pressure, all of those things. So I'm often told by patients, well, I can't lose weight because I have polycystic ovary syndrome. And I encourage you to look at it different. And that is that if you have polycystic ovary syndrome, it's even more important for you to lose weight, to get it down, because that will help your polycystic ovary syndrome and help your health. If you watch the other videos for some of the tips and do some formal effort to lose your weight, then you can lose it. Is it harder for you to lose if you have polycystic ovary syndrome versus somebody who's of equal weight who doesn't? I don't know that anybody can prove that. I don't think there's any value of that. Comparing yourself to others, I mean, we all know that friend who's skinny and can eat whatever they want, and it drives us crazy. But what you don't know is they have other health issues and they have all other problems. For example, a lot of the thin patients I have chronic constipation and real problems with that. So rather than being jealous of the others, focus on what we can do for ourselves to keep ourselves healthy and happy. And hopefully you can look at the other videos to get some tips to get your weight down. I hope you found this useful, and please leave your comments. Thank you.